and welcome to episode 2 of Endogenius. Breathwork has been receiving a lot of buzz lately, and rightfully so. Breathwork is extremely effective in elevating your mood, reducing stress and anxiety, and has been found to reduce inflammation. What doesn't get as much media attention, however, is the importance of preserving respiratory health. Lung cancer is the leading cause of death in both men and women in the United States, and chronic lower respiratory disease is the number 4 cause of death. Nearly 37 million Americans live with a chronic lung disease like asthma and COPD, which is a group of diseases that causes obstructive airflow and comprises emphysema and chronic bronchitis. With those stats in mind, it's vital that everyone, not just smokers, understand not only the circumstances that lead to respiratory illness and disease, but to learn about and apply preventative measures to protect your lungs over a lifetime. Today I talked to Dr. MeiLan Han in depth about lung health. MeiLan is a medical doctor and researcher, and a professor of medicine in the Division of Pulmonary and Critical Care at the University of Michigan. She's double board certified in critical care medicine and pulmonary disease and holds a master's degree in biostatistics and clinical study design. MeiLan serves as a spokesperson for the American Lung Association and is on the scientific advisory committees for both the COPD Foundation and the American Lung Association. She's currently an associate editor for the American Journal of Respiratory and Critical Care Medicine and serves on the editorial boards for Thorax, Lancet Respiratory Medicine, and the Journal of the COPD Foundation. As if all that wasn't keeping her busy enough, she's also the author of the incredible book, Breathing Lessons, A Doctor's Guide to Lung Health, coming out on November 2nd. Today we're going to talk about how the lungs function, risk factors for both acute and chronic respiratory illnesses, which populations are at the highest risk, the dangers of smoking and vaping, the importance of diet for healthy fetal lung development, the role of exercise in preserving lung health throughout your life, how the pandemic changed our understanding of how respiratory infections are transmitted, and the need for Western medicine to shift from a reactive to a preventative model, and so much more. So without further ado, let's get on with the conversation. Just a reminder that this podcast is for informational purposes only and does not constitute medical advice. If you need medical advice, please consult a healthcare professional. So hi, MeiLan, welcome.
Hi, thank you.
Yeah, it's a pleasure to have you on. Thank you for being so gracious with your time. I've already provided a little bit of an introduction about you, but I'd love to hear in your own words a little bit about how you wound up specializing in pulmonary and critical care medicine, and how you were led down this path to write this book, Breathing Lessons.
Well, thank you for asking. So I actually grew up in Idaho, which often people are somewhat surprised about because it's such a non-populous state. So many people just haven't met someone from Idaho. But my dad was a nuclear engineer, and so that's kind of how we ended up there.
Was he an ARCO?
So he was. So he did work for one of the government contractors at something called the Idaho National Engineering Lab.
Cool.
So yeah, they have a whole nuclear test facility there. So it's like a totally different story. So that's where I grew up. And, but I was lucky enough that the University of Washington has a partnership deal with Idaho. So I was able to attend medical school in Idaho. I had some volunteer experiences there and just in an emergency room, and fell in love with just getting to help people and just the science of it. And I just thought everything about it was super cool. So after that, I ended up I was actually born in Ohio and had family in Ohio, still do. And so that sort of pulled me back to the Midwest for my residency and fellowship. And during residency, I just got really excited about pulmonary and critical care medicine, working in the ICU, understanding sort of the physiology and sort of that intense environment of kind of real-time problem solving and trying to help patients. So I ended up staying on for fellowship, haven't left the University of Michigan, but I've had kind of a meandering career since then. I still enjoy seeing patients and things like that, but I've also started to do quite a bit of research. But at the core of it has always been some advocacy has always been really important to me, and trying to figure out how we can better help patients and help patients to be better partners in their own healthcare. And so I've had the privilege of working with the American Lung Association as a volunteer spokesperson for quite some time now. And as part of that, when the pandemic hit, suddenly a lot of people had questions about just how do the lungs work and what happens when lungs fail and what is a mechanical ventilator and how does it work? And is it a good thing or a bad thing? And so I had the opportunity to do another podcast, Freakonomics.
Cool.
Yeah, so that was really fun. And as part of that, actually, a gentleman named Matt Whalen, who is an editor at Norton Publishing in New York, heard the podcast and reached out to me about doing a book.
That's great.
It turns out there actually really isn't much in the way of sort of a simple primer for anybody who has lung issues or is curious about the lungs, that they could just kind of pick up and quickly kind of understand what's going on in a really kind of simple but still informative and accurate fashion. And so I put myself on a schedule and worked hard and got the majority of the book done last summer. And so in the last year, just been working on editing, et cetera. And then now it's due to hit bookshelves on November 2nd. So I'm really excited about it.
Yeah, that's exciting. I can't wait to read it. It looks great. And you're right, it is a unique book because I think there are a lot of books about breathing techniques, specifically for like stress reduction and things like that. But nothing really medical, nothing in terms of how the lungs work and how to protect yourself against respiratory illnesses. So I'm looking forward to it. And speaking of that, I think a lot of people, they have a general understanding of the purpose of the lungs. They think of them as a pump. It brings in oxygen, it expels CO2, but they don't really dive deep beyond that. I know one of the first things you do when you get a new patient is to explain to them, the structure and the function of the lungs at a deeper level. So if you have treat us like a new patient. If we came into the office, what would you want us to know?
Well, I think there's a lot of things about the lung that are somewhat complicated and you don't really think about it. And some of this is nuanced based on what the patient might have. But, as you mentioned, the general function is get oxygen in, get carbon dioxide out. One of the things that patients often don't think about is the fact that we're negative pressure breathers. So what that means is air is pulled in passively when the diaphragms contract. When they contract, they start out as sort of twin domes, and then when they contract, they flatten. And as they flatten, the lungs expand, and then air is brought in passively. So what that means is if there's anything that affects sort of that shape and the mechanical position and the mechanical advantage that the diaphragms have, it will make it harder to breathe. So for instance, I often take care of patients with something called COPD or chronic obstructive pulmonary disease, which often, but not always, is related to smoking. As the lungs get bigger because they lose their sort of general elasticity, what happens is the diaphragms get pushed down, and then when you go to take a breath, there's actually nowhere for them to go. And so very little air is moving in and out, and we call that air trapping. In other kinds of conditions, actually, that elasticity of the lung becomes too strong, and the lungs shrink. And then it gets harder for them to kind of open and close. And again, that can lead to problems with shortness of breath. One of the other things that I go through in the book, which I think is really hard to understand for many patients, is that the lungs actually have what we call a dual circulation. So they get fed by something called the bronchial arteries for themselves. But their main job is actually to help with blood for the rest of the body. So you've got blood dumping into the lungs from the right side of the heart, picking up oxygen, dumping into the left side of the heart, and then moving out. And so when there's problems with the pulmonary circulatory system, for instance, that's how you get things like pulmonary hypertension, and that's much more difficult to both diagnose and treat. So, depending on what the patient's exact issue is, whether it's an airway issue or a blood vessel issue or a scarring issue or an air trapping issue, I try to kind of draw things out for them and help them to understand where exactly in the process things are going wrong.
I see. Yeah, and you spoke a little bit about smoking. You said most COPD cases are caused by smoking, correct?
Many, but not all. About 20% of cases are not.
Right. And I think I saw reports that said, chronic lower respiratory diseases, the main cause of them is smoking. Like you said, it accounts for about 75% of cases. And I think worldwide, it's the number one cause of preventable disease. I saw a WHO report released in 2017 that said smoking is causing about 7 million deaths worldwide, expected to increase to 8 million by 2030. And this isn't news to anybody. I think everybody knows that. But one thing that I'm seeing, this new phenomenon, it's not super new, but over the past decade or so, we've been seeing a lot of, especially college age and younger kids, vaping. And I think for a time, vaping, I don't even think it was called vaping. They used to call them e-cigarettes or electronic cigarettes. And the point of them was to quit smoking, right? That's why people used them initially. There were bans on smoking indoors, and they thought this was water vapor and we can get away with using them inside. Now, I think they're being more advertised in terms of like a social status or social image thing. But people tend to think that they're safer. Are they in some way safer than cigarettes? Or are they as addictive? You know where I'm going with this.
So from a nicotine perspective, they're probably more addictive because the nicotine concentrations are so high, and it's not like you have a pack. You've got like vape juice, or depending on how it comes. What most people that have looked at that believe that in general, based on how much an average vapor uses, for instance, versus combustible cigarettes, most people are getting more nicotine. And so, I think at one point, some of the companies had been suggesting that it might be valuable as a quit aid for, switching, say, from combustible cigarettes. This is like your safer alternative, but there's really no data to suggest that they're actually helpful for quitting, in part because, well, I guess quitting nicotine products in general, because they've got so much nicotine in them.
Very concentrated.
Very highly addictive. One of the things that's been frustrating to watch is that the FDA has been very, very slow to regulate. I think the official term are ENDS, which is electronic nicotine delivery systems. And so that covers kind of a huge range of products. But most concerning for me have been the flavored ones that are particularly targeted at youth. And, the FDA finally put out a call for everyone you had to apply to stay on the market. But they've got millions and millions of applications. And so they've just finally, I think just this fall, released that they've rejected like 55,000, but they've got millions more of applications to get through. So it's been frustrating. The data, unfortunately, it's hard to get data in, right, about something that's new. We certainly, before the pandemic hit, saw something called EVALI, which was an acute vaping-associated lung injury. And, there's patients who've had to undergo lung transplants for this. It's the problem is it's so unregulated that any random product can slip in. And so they think some of these cases of, massive lung inflammation, hospitalization, and death in some cases might have been related to vitamin E acetate that was put in some of the formulations. But who knows what the next thing is that somebody's going to decide to put in this product that's going to have the same effect. What I will say, so that we don't have super long-term data like we do on combustible cigarettes to say, for instance, it causes COPD, but the chemicals in it are just as bad, multiple tons of carcinogens and other really bad compounds that are created due to the vaporizing process. It is definitely not steam. When you think about water, for instance, as being safe. And I can tell you that in my own personal clinic, I have seen absolutely devastating consequences in short term due to vaping. I have one gentleman who was literally a world-class athlete that now has kind of chronic airway disease from just about 8 weeks of vaping exposure. I saw another young individual in my office the other day who didn't realize that they had some lung injury at birth and trying to piece everything together, but then started on top of that vaping a few years ago. And I just wanted to cry. Because this is the last person in the world that can afford to have any more lung injury. And so I think that the public has been lulled into an absolutely false sense of security around these products.
Yeah. I didn't even realize there were that many products out there, but yeah, it makes sense. Kind of like I remember like synthetic marijuana or synthetic drugs like that. The FDA might ban one substance and then they just change the formula and release a new product and keep people hooked that way. So it's a shame. But thank you for providing that information. I think there are other environmental, well, I was going to say, actually, there's the heating element too, is an aspect. Because with cigarette smoke, for instance, the end of the cigarette when you light it is like 2,000 degrees, right? So when you inhale that hot air, it's not quite 2000 degrees, but it's going to be 160, 170, 180 when it hits your lungs. And we're only supposed to be taking in air at like 90 or 100 degrees or somewhere within a normal range of atmospheric air. So there's still a heating component to that vaping, and that potentially could be causing damage to the lungs, I imagine.
I think the biggest concern with the heating element is that it takes chemicals that were sort of in one format and then burns them and creates new, even more harmful compounds on their way in. But you're right, burns is sort of a separate issue that has happened, and people, there are burn injuries that have definitely been. So it's both. But I think the bottom line is nobody should be lulled into some false sense of security about them.
Agreed. So what are some other environmental and behavioral risk factors to respiratory disease?
So in the book, I'd like to think about your respiratory health over the life course. And I think most people don't realize you don't hit your peak lung function until about 25. And so up until then, the lungs are still growing and developing. And so we really have to think on the first phase of your life about helping yourself to achieve maximal growth, because that's as good as it's going to get. And then unfortunately for all of us, it's just this slow and inexorable decline to a certain extent after 25. And so at that point, it's as the rest of our bodies age, you're just trying to kind of preserve what you've got. So in the book, I talk about sort of the first phase of lung development, which actually occurs in the womb. And this, we've already talked a lot about smoking and nicotine, but, that is also avoiding any nicotine and smoke exposure for the mom during pregnancy is also really important. Believe it or not, nicotine itself, not just so even that you might get from vaping, nicotine itself is thought to cause really long and tortuous airway development, which could predispose to things like asthma later or other airflow obstruction problems. It actively impairs the normal developmental process. So that's really kind of important, and just, kind of eating a healthy diet. There's a lot of data, about not just for moms, but later that a Mediterranean diet actually so something high in fruits and vegetables and fiber, low in dairy, meats, and saturated fats is actually good for the lungs. And so, that the fetal development period is important. But then when we get into childhood, there are a couple major things that I think about there. One of them is respiratory infections. So respiratory infections is a major killer of children worldwide. And one of the best things that we can do to help prevent respiratory infections in children is vaccinations. And so trying to, keep our kids healthy. Severe pneumonias in childhood can cause lifelong lung problems if there's scarring, and can impede development. The other things I think about are also, again, avoiding air pollution. So whether that's outdoor or indoor air pollution, there's actually some interesting data to show that when schools are built near freeways, kids have more impaired lung function than they do when schools are not built near high traffic areas.
Yeah.
Kids who live in urban environments, big cities, where they're exposed to a lot of air pollution from, again, traffic.
Car exhaust, smog.
Have more asthma and worse lung function than kids that are raised in other environments. And then there's all sorts of things, in the home to think about too, cleaning products and volatile organic compounds. One of the things that we often don't think about is that a good portion of America still uses some type of either wood or pellet burning heating system in the home. In Idaho, we certainly did. We had a wood stove. And so you've got to think about how, looking at the EPA requirements, making sure you've got an updated model that doesn't, release too much pollution into the environment in the home.
Right.
And then as you get into sort of adulthood, again, it's kind of keeping up with those healthy behaviors. protecting your lungs in the work environment. And interestingly, there's actually some data to suggest that exercise in young adulthood and your peak aerobic capacity in young adulthood is associated with preserved lung function over time. So I think many of the things that we think about as sort of being heart healthy are also lung healthy as well.
Right. Yeah, that's interesting. And, you mentioned vaccinations. I think there was already kind of, there was a little bit of an anti-vax movement that's gone back several years. I think it was isolated to some religious groups and people that were concerned with potential links. I think unfounded links to the autism spectrum and things like that. I remember a few years ago when my kids were young. At the time, they had RSV, and there was an outbreak in New York, I think in the Orthodox Jewish community, and simultaneously there was one in Washington State among a totally different demographic. And more recently, we've been seeing about measles outbreaks in the news with the Afghan refugees. There was an outbreak there, and that followed us here to Virginia, I believe. So yeah, absolutely. I think vaccinations are really important. There are people that can't get them, unfortunately, and hopefully we'll protect ourselves because the children are the most vulnerable. I think there was an unseasonable RSV outbreak here in my hometown in South Carolina. Fortunately, my kids didn't contract the virus, but there were several that were, and they were out of school just in the first 2 weeks of school. It was a little odd to have that at the end of the summer. I didn't expect that. And what about the flu? How would that affect it? I think last year there was like a 96% drop in flu cases, and they're expecting that to increase this year.
So one of the things that we're seeing is that a lot of the measures we're using to protect ourselves against COVID are also helping us protect against all sorts of other respiratory viruses. What I saw was a huge plummet in patients coming in with acute respiratory issues, particularly last winter, that I normally would have seen. And I think people were staying home, masking. And one of the interesting things is that we have learned is that I think there was this prior thought that many respiratory viruses were not transmitted via aerosols. The thought was that they were primarily transmitted via droplets. And this is why at the beginning of the pandemic, we didn't see as much public health guidance on wearing masks. Instead, it was focused on social distancing, hand hygiene, things that would actually, help with droplets that are larger and tend to fall to the ground. Mm. What we've learned is that, in fact, we were wrong, and that a lot of respiratory viruses, such as SARS-CoV-2, which causes COVID-19, actually are transmitted via aerosols. And so this requires an entirely additive layer of protections against aerosols, which includes things like improved ventilation and mask wearing, which helps to both prevent spread as well as prevent uptake for the wearer. So I think we saw a lot of just drop last winter, but then as restrictions this summer were lifted, as you pointed out, all of a sudden we saw this spike in RSV in the summer, which we almost never would have seen. So for our listeners, RSV stands for respiratory syncytial virus. It is a common virus in the public, but can cause pretty significant respiratory infections, particularly in the young and the immunocompromised. We saw this sort of uncharacteristic spike. To be honest, I'm not sure what to expect this winter with flu. We did see a drop in flu transmission last year, but I think it's because people were relatively strict about mask wearing and social distancing and staying at home last year. I think a lot of the world is kind of moving back to sort of this new hybrid normal, and we've got more kids back in school. So I expect my best guess is we are going to see more flu this year than we did last year. Now is official flu vaccine season. I actually got mine this week. So I think that is an important public health message.
Yeah, absolutely. And, your earlier answer to my question kind of broke down a lot of things. So I'm going to keep going back and addressing some of those things. You mentioned exercise, right? And I think it was DC Neiman in the journal Medicine and Science for Sports and Exercise, I believe back in 1994. He was the first one that mentioned the J curve relating exercise to immunity. And it basically shows that there's a curve where sedentary people are more immunocompromised, specifically as it relates to upper respiratory tract illnesses, right? And there is kind of like a moderate level of exercise that keeps you in that healthy range, but then also people that do a lot of high intensity are more vulnerable as well.
So, yeah, I think that exercise probably helps the lungs in two ways. The first is just the mechanics of it. The diaphragm itself probably isn't strengthened that much, but the accessory muscles are. And the accessory muscles of your chest and upper shoulders and back actually also help you breathe. So as we exercise, we probably strengthen those that probably to a certain extent help lung function. The more you exercise, the more efficiently your body's able to use the oxygen and get rid of carbon dioxide, which means when you go to do something, if your body's more efficient, you will be less breathless. And so you're a better machine. You just function better. But as you point out, there is also some evidence to suggest that exercise may decrease inflammation. And I think that is sort of one of the really interesting pieces here. We don't fully understand it. But what the data shows is that if you have kind of this base level of fitness in young adulthood, and if you keep it over time or possibly even improve, that was the group that had the absolute best lung function, as they were getting into late middle adulthood and kind of, later adulthood. And so it is a good question. I don't think we fully understand the relationship between exercise and inflammation, and exercise and boosted immunity. But I think that the early evidence that we're getting along those lines suggests that that it may be some of these anti-inflammatory effects that are also beneficial for the lungs.
Right. And as I was mentioning, I think those people that do a lot of high intensity exercise maybe just causes undue stress, and that increased level of stress on the body might be pro-inflammatory as opposed to anti-inflammatory. So it has the opposite of the desired effect.
Yeah, I think there is likely a sweet spot, and it's hard to know exactly where that sweet spot is.
Yeah, it's probably relative.
But I think it's probably somewhat common sense driven as well.
Yeah. So, and then we spoke about nutrition. I think you were talking about it mainly in terms of pregnancy and healthy lung development for the fetus, right? The Mediterranean diet. There's a lot of information out there, I think, that is kind of like angrily pointing at the media, the FDA, and things like that, saying, why aren't we talking about vitamin D? Why aren't we talking about sunlight? Why aren't we talking about omega-3s? I think it's an important distinction that nutrition and these key nutrients may help. They help the body perform optimally. They'll help. So then thereby they're going to help your immune system perform at an optimal level, and it'll make you more resistant when you're exposed to a viral infection. I think the confusion though is that, it could be used as a treatment for viral infections. It's not a treatment. It's not a vaccine.
Right. So what we're talking about here when we think about things like vitamin D, there are some studies that have, well, first of all, vitamin D is important for a healthy immune system. So just from sort of a basic science standpoint, it makes sense that we might be talking about vitamin D. We also know that people who are fairer skinned and live, in northern climates tend to have lower levels of vitamin D than others. So here in the U.S., we in general probably have, for instance, much lower levels of vitamin D than people that live closer to the equator. So the question has been, to what extent vitamin D levels are associated, though, with lung disease. And I would say the data are a little bit mixed. Not every study has shown a clear relationship, but there definitely have been some studies that have pointed to poor lung health with lower levels of vitamin D. But I'm not aware of any data to suggest that, vitamin D in the acute, like, I've got a cold, I need a shovel in vitamin D,
right,
is helpful. It's more sort of preserving your health over time. And I have to say, in writing the book, one of the things that I spent some time thinking about is that so much of what I do typically is reactive as opposed to preventive. And I know that that's sort of this whole kind of thing that we've been talking about with Western medicine for quite some time, that our focus is very reactive. But I think, if we look at, for instance, heart disease has very much moved into the preventive space. And that's why we've had huge drops in deaths from heart attacks and strokes, because now people get their blood pressure checked and people get their cholesterol checked. And if there's an issue, they're put on diets and they're, told to lose weight and put on antihypertensives and cholesterol lowering medications. But we haven't had that same approach to lung health. And most of the patients, by the time I see them, are quite sick. And so, for me, it sort of the part of the book for me is somewhat of a call to action that we as a society, we as as healthcare providers really need to be helping people to think not just about what do we do when you get really sick, but how do we help you from needing to get into my office in the first place. And so I think things like exercise, things like good diet and adequate vitamin D, things like that are all part of that.
Yeah, absolutely. I think it's definitely the case that most people wait until they have a diagnosis of disease before they start to take action. So it is very much reactive, on the part of healthcare and on the part of the patient. So there's definitely a case, especially with respiratory health, that we should be talking about some nutritional components, some behavioral components that people could be doing to keep themselves more resilient. But when we're in the middle of a pandemic, that's definitely an important conversation, especially for those that are already healthy. But those who have contracted the virus, taking in key nutrients is going to be important, but a little bit past the start gate there. So, okay. Now, while we're talking about some preventative measures, stress, I think, is on the top of everybody's minds too, especially, there's been a shift in the culture towards more mindfulness. We were talking a little bit before we started recording about the pandemic and being at home with children and working from home and kind of having to juggle all of your life responsibilities under one roof and being stuck. So there's a lot of pandemic related burnout. People are more mindful about stress. And we also talked about a lot of the books relating to breathing for stress reduction, things like that. I think it's a focal point in yoga and meditation. Do you think that those types of breathing exercises could be beneficial and preventative?
I do. So most of the research, at least that I've been involved with respect to that, has been focused on helping patients who do have lung diseases specifically. So when you think about it, not being able to breathe makes you very anxious. That's sort of it's just natural. If you can't breathe, all of a sudden that's very scary. Like you're drowning or, you might die. It's panic inducing. And so for patients who live with chronic lung disease, if something, trips them up, it naturally is very scary. The problem can be for some patients that the faster they breathe, the more air they trap. And then the more air they trap, the worse the diaphragms are placed for actually getting in another breath. And then the problem just gets worse and worse and worse. And so what we found is certain techniques, one of which we call purse lip breathing. But it's where you kind of purse your lips together like you're going to whistle or something like this. And then you take a deep breath in and you slowly blow out. And by slowing down the breath and then breathing out against some pressure, you create this resistance to breathing out by pursing your lips. It actually drives air back down into the lungs. And what we think happens is that what can happen is as air rushes out of the lung, sometimes because certain parts of the lung are not functioning well and either due to loss in elasticity or the airways becoming tiny or clogged with mucus, the airways close off before the air can get out. By causing that a little bit of back pressure, we think what happens is that it allows the air to act, it tends those tiny airways open so that the air actually can get released and you can relieve some of that hyperinflation, which then makes the next breath easier and better. And so there is some good evidence to suggest that techniques such as, pursed-lipped breathing can help patients feel better, can help reduce anxiety. And so, for instance, when I send patients to pulmonary rehabilitation, which is a comprehensive program including exercise and education for patients with chronic lung disease, one of the things that they will be taught are breathing techniques and breathing exercises, such as these pursed lip breathing maneuvers, which I think are very similar to some of the things that you might do, for instance, with yoga breathing and things like that, which I think absolutely do have a calming and anti-anxiety effect, and I think for logical reasons.
Yeah, and potentially then reducing inflammation as well if you're able to damp down that stress. So we talked a bit about, before we started recording, I was telling you about what my day job is as a energy efficiency and sustainability consultant, and you'd mentioned indoor air quality before, so I wanted to circle back to that a little bit because that's kind of my wheelhouse. A lot of what I do is energy related, but also indoor air quality related, depending on the project. But there are a lot of things that people can do to be reducing the number of allergens and off-gassing from materials in the house and things like that. So they could be, and they should be, changing out their air filters for the HVAC system at least every 3 months. I think the best thing that they could do is look for a MERV 13 filter, which is going to filter out like 90% or more of the particulates in the building. It's just as good as having an air purifier, with a HEPA filter. They should be dusting, mopping, and vacuuming relatively frequently. Again, like a lot of upholstered materials do off gas. So reducing that, changing out their candles or fragrances, trying to eliminate fragrances at all from the house because those release VOCs. Potentially using soy or beeswax-based candles with essential oils instead, which are just as beautifully fragrant, if not better, in my opinion, because they're not so overpowering, and using low VOC paints, adhesives, sealants, and things like that whenever they do work on the home. So a lot of that is important. Also just reducing the amount of pollutants that get in and out of the house if you have a walk-off mat outside and things like that. There's some simple things that you can do to protect the indoor air quality of the home. I live in a humid climate too, and you'd mentioned ventilation. That's a big issue in a lot of homes, especially like in South Carolina, Florida, southern, or maybe not southern, but northern California, like San Francisco, has a lot of these issues. And if there's poor ventilation in the home and you have moisture buildup, then you have potential mold issues, which could cause respiratory infections too, I imagine. Mucormycosis.
Yeah, it's mold gets a lot of press, and patients are often very concerned about mold. And to be clear, there's mold everywhere. There's mold in the soil. I'm sure, despite the fact that I hopefully don't see any mold in my home, there probably is some. And obviously, if you see a wall full of black mold, that's not good. But the interesting thing is that it's been a little bit more challenging to actually link that to respiratory disease. To be honest, the majority of patients I have that have mold-related respiratory diseases are pretty severely immunocompromised.
And what's the origin of it? Is it typically in the house?
The mold's everywhere. Yeah. It's in the soil. It's just environmental. You can't avoid it. And so, it's much less common to see molds. People think, I've got black mold growing in my lung or something like that. That's actually very, very rare, unless you're severely immunocompromised. Sometimes there are certain fungi that we will see that can perhaps colonize and irritate the airways of patients with asthma in particular. But what I like to tell people is, like, if you've got something in the home and you're trying to clean it, whatever it is, whether it's mold or, I don't know, like last year I cleaned out my garage and it hadn't been cleaned out in quite some time. And honestly, I'm not sure what was back there between insects, mice, I don't know what has been, we accidentally leave our garage door open all the time. And
I've been there.
Who knows? But whenever you're going to be cleaning or kicking up dust, just be really conscious. I think we just don't stop and think to protect ourselves. If you're going to wear gloves, put on a mask. So I even, I have more N95s around the house than I used to just because of the pandemic. So, when I cleaned out my garage last year, I just wore an N95. Mouse droppings have been associated with hantavirus and things like that, particularly in the Southeast. You just think about what you're doing. Don't mix household cleaning chemicals. If you have a strong odor in your environment, investigate it. Interestingly, even things like ink cartridge and toner spills in the office, those actually can kick up quite a bit of dust and actually can be really harmful. So you want to be really careful about how not to kick up dust. If you can see it, then you can probably breathe it.
Yeah.
And so, just be mindful. Yeah. I think I spent a good portion of my life not being mindful, and then all of a sudden you be cleaning something up and start coughing, and it's just not good. Every time that something like that happens, it's just another insult. So I think we just kind of have to be aware that even though we can't see our lungs, just like we would protect our hands or any other part of our body when doing something like that, we have to protect our lungs too.
Yeah, I mean, it's just something that happens unconsciously. People always say it's as easy as breathing, so they don't really think about them. Out of sight, out of mind. But occupationally too, I was wondering if a lot of your patients may work in certain industries. I wonder if I work in construction. I'm a building consultant, so I'm on site a lot, and sometimes I'll see the drywall guys or whatever specifically, and they're just covered in dust. Sometimes they're not masked. Painters are usually just caked in this stuff, and I wonder if they're at higher risk than others.
Oh, absolutely. A significant portion of chronic obstructive lung, chronic lung diseases have been associated with occupational exposures. It's been shown in many studies, whether that's dusty jobs or fumes, paints, etc. Hairdressers, for instance, exposed to
all the aerosols.
Yeah, aerosols. So there's a lot of jobs, I think, where and that's where you do what you can to replace products out with more environmentally friendly products, where you can, and then you wear a mask when you can't.
Protect yourself, right? Yeah. Is there any? This is a little bit of a rhetorical question, but I think that there's information about this that's still circulating. Is there any threat to your lung health by masking up, particularly in children? We're seeing a lot of people getting into fights with school boards and things like that.
There's just so little evidence that that's actually harmful. Even patients with really severe chronic lung diseases can usually wear a mask without significant harm.
So it's not reducing your oxygen concentration?
Not by much. I think I saw one study that suggested perhaps there was an increase in carbon dioxide when people were exercising really hard and wearing a very tight-fitting N95.
Recirculating that air.
Nobody's asking children to wear an N95 to school.
Right, yeah.
We're just...
They're wearing the surgical mask, they're loose.
Loose-fitting facial coverings that are, grabbing droplets and stuff that's kind of, spraying out of the when the child talks, but the air is circulating very freely on the edges of those masks. So I just no. And in fact, I worked with the American Lung Association, the COPD Foundation, and the American Thoracic Society, as well as the American College of Chest Physicians about a year and a half ago, closer to the beginning of the pandemic, and we actually felt it important to put out a statement to say, we as lung doctors not only think everyone should mask up, but even our patients with chronic lung disease can safely mask up. And the number of exemptions that should be given should be very, very few. And I'm not saying there aren't going to be some rare, instances, but the majority of patients, including children, or individuals, I should say, including children, including individuals with chronic lung diseases, should be able to wear the kind of standard mask that we're asking most people to wear.
And in terms of efficacy, I think I've seen a few arguments about whether or not, so for instance, cloth masks or surgical masks are able to stop the transmission of SARS-CoV-2. They may not do as good of a job as N95 masks, for instance. But is there an issue there?
You're right. N95s are better because they're very tight fitting, and they've got this these ultra tight filtration systems that would get down to just the tiniest of tiny particles. So, if we're going into a high risk situation, for instance, in the hospital, yes, I will be wearing an N95. But, there's actually some interesting sort of anecdotal evidence, and I think some of it's even been written up, at certain points at the peak of the pandemic in kind of spring of 2020, health systems were running out of masks, out of N95s. And so in some health systems, including that at the University of Michigan and others in New York that I'm aware of, there was a time period where even when we had COVID positive patients, healthcare workers were wearing surgical masks. And we still saw significant drops in transmission and ability to protect people, even with just the surgical masks.
Right.
So while they're not as good as, an N95, I still think they provide a really significant level of protection and still make a lot of sense. There's data now that's coming in from schools that are back in person where the schools are masked in general versus the schools, masking is required versus masking is not required. And the CDC has already reported significantly higher rates of infection and transmission among the schools that are not universally masked.
Yeah, and in the 2 states where they've actually banned mask mandates in school, threatening school officials with fines or eliminating their salaries, we're seeing that. So in the past 3 months, the death toll in the United States, I think, has gone from 600,000 to 700,000. And 30% of those have just been in Texas and Florida, where they're kind of actively undermining efforts at reducing transmission. So there is definitely plenty of evidence that masks are working. Thank you for that. So I wanted to ask also, I know this is kind of your area of expertise. Is there a particular demographic that's more at risk of developing respiratory diseases than others? For instance, I know you focus on women with COPD.
Yeah, it's interesting, this interaction between sex and respiratory disease. So just to give you an example, my son has some mild asthma. When you look at children, young boys are actually more likely to have asthma than girls. The lungs for boys develop later. So, for instance, my son was born prematurely, and when you have infants that are born early, it's boys that are going to be at increased risk for their surfactant develops later. They're going to be at increased risk for respiratory distress if they're born earlier. They're more likely to have asthma early. But as kids get older, and particularly as girls go through puberty, what we see is a shift in that demographic, and moving into adulthood, women make up the majority of individuals with asthma. So there's clearly sex-related differences for lung health as they relate to differences in development, and then other things that happen, hormones likely, differences in the immune system as we get older that do predispose women versus men for different things. Another lung disease so idiopathic pulmonary fibrosis, for instance, is a disease mostly of middle-aged and older adults. We see sort of a double predominance in men over women. And we don't fully understand that. And then even other lung diseases such as COPD may just present differently. We're used to hearing about how, women may, for instance, be more likely to have silent heart attacks or present differently. And so heart attacks in women don't get picked up. And so hence like the Women in Red campaign and things like that to kind of increase awareness. Well, I think we do have some of the same issues with respect to respiratory disease, both in how patients may present, but also in physician bias, unfortunately. So physicians, for whatever reason, tend to think as patients, at least for many years, thought about patients, for instance, with COPD as being old men. And no, in fact, we see quite a bit of COPD in women as well. And so helping physicians to better kind of understand the symptoms and the demographic, and, pushing doctors to better question patients about risk factors and symptoms, and getting both the public better aware and physicians better aware to push for screening of lung diseases is really important.
Absolutely. And my dad's a physician, and one of his primary concerns, or one of the things that he always communicates with me, is that he wishes patients were better able to communicate what they were feeling, what their issues were. So, there's two parts to this question, I suppose. Is one, what are some of the warning signs that people should be looking out for? Of course, we don't want them to wait until there is an issue. We want them to take preventative measures and keep themselves healthy. But if they get to the point where they feel like something's wrong, what are some of the warning signs where they want to start thinking about talking to their doctor about this? And what can we teach them about how to communicate with their doctor about these issues? And why is that important?
So, anytime you're short of breath, that should, or more short of breath than you used to be, a lot of patients unfortunately chalk that up to, oh, I'm out of shape, oh, I gained weight, oh, I was smoking, etc. That or cough or chest pain, really anytime you notice a change in your respiratory symptoms, I think it's important not to just blow it off and attribute it to something as opposed to just getting it checked out. A lot of times people will modify behavior such to avoid being short of breath. So for instance, if you like to golf 18 holes and at the 7th or 8th hole, you're getting short of breath walking the course, you might switch to a cart. And then if I ask you, are you short of breath, say no, but you've switched to using a cart for the whole thing as opposed to walking like you used to do. So even, changes in how you manage your life, even if you don't think, maybe you don't even think about the fact that you did that, should, trigger you to consider talking to your doctor, particularly if you've got risk factors, if you've got a dusty job or exposed to fumes or secondhand smoke, or if you smoke or vape. Those are all things that will increase your risk. When you go into your doctor, the thing that you want to ask for is something called spirometry or breathing test. That is usually the first screen that we'll do. And, if that's abnormal, you can certainly ask to be referred to a lung doctor if your primary care doctor isn't sure. Sometimes it may be more straightforward, in which case your primary care doctor may be a great person to start with treating whatever it might be. Honestly, if they do that and don't pick something up, there are more extensive breathing tests and exercise tests that I will run in my office. I will sometimes also get CAT scans. So if, even if that initial evaluation doesn't show anything and you're still thinking something's off, then I think that's the time to push to be asked to be seen by a specialist who can run more extensive testing and really dive in and make sure nothing's wrong.
Yeah, thank you. Yeah, a lot of people do chalk it up to either age or maybe they're just a little bit overweight and getting out of shape and brush it off down the road until maybe it's a little bit too late. I wanted to also talk about your research, because something that's really interesting to me about your research that highlighted my ignorance was, just to say a little bit about what you do, it's defining the different phenotypes of COPD, right? So that was news to me because I thought COPD was COPD. I kind of used it interchangeably with emphysema. And if I'm that ignorant, I imagine a lot of other people are too. I just thought it was one thing. So can you talk about, what that means exactly and why it's important?
Well, one of the things we don't really understand is why some people smoke for a long time and don't have problems. Other people smoke, for a couple of years and walk in my office and can barely breathe. And then when I look at those patients on CAT scans, and a lot of the work I do is with imaging and post-processing analytics of CT scans, why some patients, patients don't all look the same. So lymphedema is where the lung sacs have been destroyed and we can actually see holes in the lungs. And that's one thing we see with COPD. But other things we can see with COPD are airway scarring, narrowing, loss of airways actually. Other patients seem to have more problems with their blood vessels. And so you really just get this, you can have 3 patients who all have the same breathing test, same levels of severity, say on their breathing test, but then I'll get a CAT scan and all the CAT scans are totally different, in how much emphysema they have, airways disease, and where it is in the lung. And so that's what we're really trying to figure out is why does one patient look like this and why does another patient look like this? And ultimately, the biggest question for me is what does that mean for treatment? Should I be treating patient A with one thing and patient B with something else? Or do I need to be developing a drug that specifically targets X versus specifically targets Y? Most of the therapies that we have for COPD are pretty general, like almost anybody would qualify for them. In the past few years, we have started to come out with, there are some newer therapies, for instance, there's lung volume reduction surgery, and now there's these new endobronchial valves that we can use. And those are for patients with very specific amounts of emphysema in very specific locations. And that we have to kind of figure out when we bring them in and run them through more extensive evaluation. So we are starting to come up with more specific treatments as we learn more, but I think there's just so much more that we could be doing to hopefully ultimately just slow progression of disease.
Yeah. Yeah, so it sounds like that there's different, patients will present with different comorbidities, and it allows you to determine that there may be a different root cause, and that can determine treatment, and you can use it prognostically, I imagine. Yeah.
Yeah, so it's a really, I think, important area of research. It's a little bit slow going.
Yeah,
but,
natural. Well, all new things are. So that's interesting too, because there's another fascinating bit of research while we're on the topic of research that I found from one of your colleagues at University of Michigan, Dr. Robert Dixon. I think this is super interesting because the gut microbiome is on the top of everybody's minds these days. Like everybody's talking about it, the gut-brain connection, how it connects to your immunity and everything like that. But what Dr. Dixon is at the forefront of the lung microbiome right now. What do we know about that? Not much right now. I imagine it's a few years behind the gut microbiome, and we still don't know half as much as I think people pretend to know.
Yeah, so the interesting thing is that we thought for a long time that the healthy lung didn't have any bacteria in it at all.
It was a sterile environment.
It's totally sterile. And now we're realizing that there probably are some bacteria in there. It's still somewhat debated how important they are because it's not sure that they actually live and replicate down there. Maybe they just kind of got washed in from above, but they definitely are there. And so I think the significance of that is still not clear. But what's even more interesting is as we start to look at patients with chronic lung diseases, what's becoming more clear is that for those patients, there are also probably resident bacteria there all the time. And it can differ on what part of the lung you sample. It's different from patient A to B. It changes based on, it's like this own little microcosm and, ecosystem. And, you give it an antibiotic or you change an inhaler and all of a sudden the ecosystem changes. And we're just trying to understand now how, what's cause and what's effect. So, are there, for instance, for many years, we didn't understand that Helicobacter pylori caused ulcers. So we're trying to figure out now, okay, to what extent are some of these bacteria we're picking up actually driving disease? And would altering the microbiome or trying to alter the microbiome in some way affect course of disease? So it's a very active area of research, and it's really been fueled by some of the things that, for instance, Bob Dixon, as you mentioned, is doing, because used to be we just relied on what we could culture, and what we could culture is actually limited by technique. Now we've got much more sensitive ways of picking up what bacteria in the lung by just running the DNA on all the bacteria. So once we do that, we can now, we realize there's thousands of different species in there, and we're just learning a lot more by looking at culture independent techniques.
Yeah, and we still don't seem to know if there's a connection between that environment, the ecology in the lung, and disease progression, things like that. So I look forward to finding out how that evolves. I know it's an emerging field, so that's exciting.
Well, you should have Bob on the show.
I'd love to. Yeah, I'd love to. That'd be fantastic. So we've talked about a lot. We talked about how the lungs work, a lot of risk factors to respiratory disease. We've talked about some protections, exercise, nutrition. I'll add sleep in there, reducing stress, things like that. Are there any other key takeaways that you want to leave the audience with before we go?
I think it's just to be aware of your environment and what might be there harming your lungs, and to be, proactive as well as, just be aware. And if you have any concerns, raise them with your doctor, because, one of the problems we're facing is, there's a blood pressure cuff in every single doctor's office. You would be shocked if you didn't get your blood pressure measured every time you went. The majority of your listeners will never have had their lung measured ever. And so
we should be asking for that, you think?
If you've got any reason to have any concerns, you should ask for it, because the majority of patients get picked up really late. And it's a real frustration, and it's a challenge on how we help protect people when we just don't even know where most people are at with respect to their respiratory health. Right. So, I think that would be my advice. If you have concerns, push on your doctor to get get breathing tests.
Yeah, be diligent. Excellent. So the book is called Breathing Lessons, A Doctor's Guide to Lung Health. I'm going to link it in the show notes. You also have a website, drmeilanhan.com, right?
I do.
Okay, excellent. We'll link that as well. Is there any place else that people can connect with you? Are you on social media or
I am on LinkedIn, Twitter, and Facebook.
Okay, wonderful. Okay, well, we'll link all those. Thank you so much for your time, Dr. MeiLan.
Thank you so much. It's to have a chance to talk to you.
Wonderful. Thank you so much. Bye-bye.
Thank you.
Thank you for listening to my conversation with Dr. MeiLan Han. Her debut book is Breathing Lessons, A Doctor's Guide to Lung Health, which is going to be released on November 2nd. You can find it on Amazon.com and in bookstores everywhere. If you're interested in learning more about the book, her blog, or finding out more about her research, please visit the show notes.